Hi, I'm Dr. David Dow, and we're here in our exam room at Dow Chiropractic and Acupuncture. And what I want to talk to you about today is a question I get all the time, but how can acupuncture help with my chronic pain or with my arthritis pain? And so the truth is everybody's different with that. But the thing when we think about with chronic pain is that it's already been there for a really long time. It's had some time to degenerate and deteriorate. So when we're talking about arthritis, we're talking about the joints. And the joints are inflamed, and maybe those joints have started to deteriorate. And this is kind of what we're looking at with arthritis. So what happens is we always start out with everything nice and normal and healthy, and everything's in great shape. And then things can start to deteriorate over time. So when the joints are nice and healthy like this, there's no pressure on the nerves. And the nerves are totally healthy. The bones can move around really smoothly and easily. There's no rough edges. The bones are nice and smooth. And this is where there's no pressure on the nerves and everything is totally healthy. Now this is phase 1 degeneration. This is phase 2. This is arthritis. And this is basically showing pressure on the nerve from pretty much every conceivable possibility on here. So what's happened is the disc in between the bones has gotten really thin, and now there's not as much room for the nerve, and the nerve has gotten really small because of that pressure on the nerve all the time. This shows what a herniated disc might look like pushing against the nerve right there, and that looks like that would really hurt. The other thing is, because we've lost the cushion that disc is, any impact to the spine, you can feel that right into the nerve. It doesn't absorb that pressure. And because we have these bone spurs on here, sometimes those bone spurs can poke right into the nerve, and that's going to be causing pain. And because it's almost bone on bone, we lose that range of motion. Now, when the nerve gets injured, there's electrical energy that runs through the nerve, and that nerve will pour out into the tissue. So if this is in the low back, that energy may pour into the low back, it might pour into the hips. As it gets worse, it can go all the way down the leg, all the way to the foot as it gets much, much worse. In the neck or the upper body, those nerves might go into the shoulders, between the shoulder blades. They might go all the way down the arm to the hand when they get real, real bad. Or it could be causing headaches or neck pain. And sometimes those upper neck nerves will pour over the back of the head and up into the head, and even make the forehead get tight and the jaw can get tight. And those are some of the things that can happen. But when that energy accumulates in the tissue and builds up, acupuncture, what it does, it's like pressure building up in a bubble. And if I take an acupuncture needle, I can pop the bubble and let the energy escape. And when that energy comes out of there, it's like a relief. The pressure is coming out of there. And that electrical energy makes all the muscles tight. So the tension of the muscle cuts off the blood flow, so the area can't heal very well. And when we let that energy escape and the muscles relax, the blood flow increases and those areas can start to heal much better. So acupuncture can be really helpful for chronic pain. But the truth is everybody responds differently to acupuncture. Part of that has to do with how much damage is in there. When those nerves get down to all the way down into phase 3 degeneration, and the nerve is atrophied, that can feel like numbness. And a lot of times that means that nerve is dead. And if that nerve is dead, the acupuncture is probably not going to be helping too much at all. But at the same time, there's adjacent nerves that might be able to help that are still functioning. And the truth is we got to see how you respond, because everybody responds differently. And so I always like to just do some acupuncture and see how that's working. I hope that answers your questions about how acupuncture can help with arthritis. In some ways, it can be really similar to morphine, actually, they say. It has about a 50 to 80% effectiveness for back pain, whereas things like morphine have been shown to be around 70% effectiveness. So it's about compatible without having to take the medication. So right now, the FDA does not want people to be taking medications because of that opioid epidemic we're going through. So they're recommending that people do things like acupuncture, chiropractic, massage, instead of the opioids in order to deal with those problems. So if you've got questions for us, we're here at our center. Our phone number is 608-233-3588. We love questions. Celeste and I are here to help, and feel free to give us a call. So have a great day.